I understand that the government, I've seen that the government haven't amended our motion, and I presume that the government are not opposing it. And this is a tactic that I will address more in my closing remarks. Sinn Féin are more interested in providing solutions than playing politics, and the solutions are to the woeful neglect of successive governments in the failure in children's and young persons' mental health services. I'm aware that there will be parents of young people who are watching, who are desperately trying to get the proper mental health care for their children. There's a couple of parents that I know that are here in the public gallery today, listening to us today. And I want to echo the Mental Health Commission statement in their report that states that in some instances, children and young people get excellent care from dedicated staff while they're under the care of CAMHS. And whilst this is true in some cases, it is the complete opposite for many a family. Sinn Féin's motion will ensure mental health services for children and young people are properly resourced, they are fully staffed and provide support when and where they are needed. The scandals in our child and adolescent mental health services were laid bare once more last week. The government needs to act urgently to ensure that we have the services that are fit for purpose for our children and our young people. The current services are not. There are serious concerns and risks for patients currently accessing CAMHS, and this is a second report in relation to children being placed at risk while under the care of CAMHS. Where the government has failed, Sinn Féin want to offer solutions. Early intervention is key. All children and young people deserve the opportunity to reach their full potential. Children and young people must have access to mental health services when and where they need them. Services should be extended to 25 years of age to prevent children from falling off a cliff edge at the age of 18. This was outlined in Sharing Division. The majority of acute, long-term mental health difficulties develop between the ages of 16 and 25, and our mental health services must reflect this. We are calling for multi-annual funding for CAMHS, so CAMHS can operate and forward plan to be able to properly staff teams. We are calling for an integrated IT system to improve quality of care. It is 2023 and it is shocking to the extreme that we do not have an integrated IT system for children and young persons' mental health. There is a fundamental need for greater accountability and oversight across the health service. We are calling for the reinstatement of the National Director for Mental Health in the HSE, who would report directly to the CEO of the HSE and also to the Minister of the day. There has been no National Director for Mental Health since 2016, despite the current programme for government containing a commitment to reinstate the position. The Minister, you yourself have called for this, but the HSE seem to be blocking this appointment. There seems to be a big disconnect between the Ministers and the HSE. I'd like to know who is in charge. The government must prioritise the recruitment of a Youth Mental Health Assistant Director in the HSE as promised in Budget 23. This post is essential to ensuring leadership in the improvement of mental health service for children and young people, but recruitment has yet to begin. No urgency again. Sinn Féin want to empower CAMHS to be able to respond to issues raised in the Mental Health Commission's interim report. And I want to take another opportunity to thank Dr Susan Finnerty and the Mental Health Commission for publishing this report early. The report did not come to a shock to any family who has experience of accessing CAMHS. They know too well that this government has been failing young people as waiting lists have dramatically increased under your watch. We must introduce national standards for monitoring antipsychotic medications. We must develop joined-up and comprehensive health and social care workforce strategy to increase education places and training opportunities between the Departments of Health and the Departments of Higher Education. We must increase undergraduate and postgraduate courses and training places for mental health professionals. Minimum staffing levels for CAMHS must be published, so at least we have something to aim for. Our mental health services are in crisis, and Minister, we can do so much better. We owe it to our children, we owe it to our young people. Our young people deserve hope, solutions, mental health services that are fit for purpose. There is nothing worse than denying a child and young person every opportunity possible for them to reach their full potential. Good.
Oh, sorry. Well, who's next?
I'll go next.
Deputy Daly.
Yes. First of all, Ceann Comhairle, I'd like to welcome Valerie O'Sullivan, who has travelled up from Tralee to be with. She can only be described as someone who has survived her treatment in CAMS. And some other children in Kerry must laugh when they heard rhetoric about cherishing all the children of the nation equally. And their parents too, that I've spoken to, scrambling around to find a bed for their daughter with life-threatening eating disorders. The physical and mental damage caused by overprescribing and over-medication. Children given antipsychotic medication for relatively minor mental health difficulties. Ended up, one child said it felt like she was in a cartoon with the hallucinations, going around like a zombie, and when she needed help only for sleep disorder. The loss of potential and the loss of family cohesion. And then, since this government came into place, the waiting lists for CAMS have increased by 86% since June of 2020. The number of children waiting longer than a year has increased by 168%. And I heard about the state strategy coming up the train this morning about defending nursing home claims. And last Monday week, as the news broke about the Mental Health Commission report, the HSE gatekeepers, never slow to miss an opportunity, saw a good day to announce that we are confirming to the public that we will carry out a full look-back review into the North Kerry cases. But when you looked into what was actually in the statement, they said that they are going to carry it out, but you will understand it will take what they describe as a little time to put the clinical team in place. And a little time, remember this is from an organisation who last October said we would have the North Kerry review in 2 weeks' time. So they said we will also need an independent expert to chair the review. We still don't have it. And while I repeat a call for the review to stretch back over 15 years, they said that their priority is to review the young people currently under the care of the North Kerry CAMS team, which is what the HSE or what the Mental Health Commission had already got earlier on that day. So it was a bit of a three-card trick announced on that day. So I am calling for the HSE to review all the open cases as is recommended by the Mental Health Commission, to immediately regulate CAMS under the Mental Health Act, reinstate a national clinical director to ensure accountability, to develop the national standards, most importantly, for monitoring antipsychotic medication, and give us a time frame for the review of all North Kerry cases going back over 15 years, especially where risperidone was prescribed. The children and the people of North Kerry deserve no more than that.
Thanks very much, Ceann Comhairle. And first of all, I'd like to thank my own colleague, Deputy Ward, for bringing this forward, and in general for all of the work and advocacy he does in relation to mental health. So Deputy Ward's motion clearly calls for straightforward reform, that resourcing is matched with staffing and that services are available when and where they are needed. And I think that's one of the key things, because my experience with CAMS is people having difficulty accessing the service. First of all, the actual referral can be quite daunting, and then they're really genuinely fobbed off in an awful lot of cases. In CH05, which is the catchment area of my constituency, there's 314 children waiting more than 12 months for an appointment. So that's 314 extremely vulnerable children. And just to give a really recent experience I had where a child was suicidal, was presenting to their GP, was already on the list for CAMS for 2 years at this point. And they were being told as a drop-in psychology clinic, totally not appropriate at all. This child really needed the intervention of CAMS because they were already undergoing some level of counselling, but we all know there's a difference between counselling and therapy, and then the very specialised intervention that some children need with CAMS. And they actually had to present to the emergency room in the end to get that appointment. And can I say, as a public rep making representations, it was only when the appointment was given through the emergency department that then they came back to us to say there was an appointment. So I found that quite cynical in itself. My time is short and I don't want to eat into my colleagues' times, but I will just say that when it comes to children, and I say this time and time again in this chamber, we are letting our children down. In the Children's Committee today, we were listening to parents who are trying to fight for services for their children with disabilities, the most basic of services, and here we are now talking about our children with mental health difficulties being failed. So I would urge all deputies in this House, not just to support Deputy Ward's motion, but to actually ensure, I would call on government to ensure that this is actually acted upon and that we get the staff in place and that the process is made a lot easier and more straightforward for parents. Thank you, Ceann Comhairle.
Deputy Martin Kenny.
Thank you, Ceann Comhairle. First of all, I want to commend Deputy Ward on this particular motion. What we're dealing with here this evening has been years of underinvestment, and that's the reality, and we can see that across the whole state. I know my own area, CHO1, has not yet been got a report from this particular look back into all of these issues, but I'm quite confident that it will be the same as everywhere else, because the experience of the young people, unfortunately, and their families has been the same. Being let down, long waiting lists, those that are in the service finding that the service, is ad hoc. They meet somebody and there's a clinical psychologist meeting them, then that person is gone and a new person comes in and they start from the beginning again. This kind of chopping and changing has been the routine that they have had to deal with, and it has not led to good outcomes. In fact, it has led to very poor outcomes and sometimes tragic outcomes for many, many families. A couple of months ago, I was contacted by a father who told me that his child, a young woman, had been brought to CAMS, had been diagnosed, had been put on medication. Had looked to get an appointment to go back in order to get a review of that medication, which she's supposed to get after 3 months. Couldn't get an appointment. The only answer she could get from CAMS was go to your GP. Went to the GP. The GP said, OK, I'll continue the medication, but only for another 3 months because I'm not qualified to do this. But CAMS didn't have the resources to bring that child back to review her medication. And that is a problem across the entire country. And that is why we have many, many young people who have been on antipsychotic drugs for years and years and years and have damaged their health, sometimes to a stage that it has been irreversible. And I think, that the state has to own up here that we've got a problem with this situation, and the problem is that it has been under-resourced, and it's not just a matter of not having the resources or not being able to find the particular qualified people to do the job. The problem here is much, much bigger than that. The problem here is that it hasn't been recognised as something that is urgent, as something that is absolutely crucial, because we all know the old adage of a stitch in time saves 9 and getting in early and early intervention and all of those things. And yet what was left in these cases was children and their families in distress for years before they were dealt with. And the outcome of that has been continuous poor health outcomes, not just for the person or the young person who has been visiting CAMS, but for their families and for their siblings and for others around them. It is an absolute mess, and I think we need now to get a grip of this. We need to implement what is in this motion, and ministers, we absolutely need to get urgent attention to this. There's no good talking about it anymore. We need action.
Deputy Denise Mitchell.
The latest Mental Health Commission report into CAMS services must be a wake-up call to the Minister for Health and for the Government. The issue of access to mental health services for young people isn't a new one, but it's time now for the Government to get its finger out and look at proper solutions to fix this, instead of us constantly fumbling around in the dark. The aim of this motion this evening is to bring some solutions around the future of mental health services and present Sinn Féin's plan for a better future for service users. The Minister and the Government should come into this debate with a listening ear. My colleagues Mark Ward and David Cullinan are taking the opportunity to bring forward suggestions to Government to help fix the issues within the service. Now, all young people in this state, and we all agree on this, are deserving of a chance to reach their full potential and be the very best that they can be. What they need are services that are fully resourced and staffed and are available when and where they need them, even in places like education, for an example. The removal of a National Director for Mental Health by Simon Harris back in 2016 was a poor decision, and this must be reversed immediately. We all need to look at the oversight and the regulation of CAMS. We need to develop a framework around medication, particularly for long-term use, and develop standards of practice that must be adhered to and must be monitored. There needs to be more in the way of joined-up thinking when it comes to staffing and resourcing of these services, because they are dealing with really vulnerable young people on a daily basis. And it isn't acceptable that they, the young people, are expected to put up with this service that's not fit for purpose.
Minister, the situation in Cork and Kerry is as bad and perhaps worse than in most places. 857 children to be waiting, which is the largest of any CHO. 296 children waiting longer than a year. And we have very worrying news in recent days in relation to what was reported at the Aishlin inpatient unit in Bessborough, where serious staffing issues, SIPTU are raising this, with 58% of nursing posts filled. And this has a knock-on impact in terms of the staff that are still there, that are trying to plug the gaps and the pressure that that puts on. And it's hard to blame some of the staff then in those circumstances who are thinking of their future and the circumstances in which they're wondering, and then the impact that that has on the service that is delivered. The waiting lists are, as I've identified, absolutely enormous. But I always make the point in these debates, this is very far from abstract. For any of these children who are coming forward, they are under very severe pressure. Their families may well be at absolute breaking point, and even to get into CAMS, their situation must be quite serious. And I suppose that's actually one of the points that I want to make in terms of this review, is that we shouldn't simply look at those open cases, because there are children who were inappropriately refused access to CAMS and inappropriately discharged. And I'm not making that point necessarily to blame, because when you have huge pressures on the system, then of course you have to triage and decisions have to be made. But there are children with very, very serious mental health situations who are being refused access because of the numbers that are there. I have heard instances of children who were self-harming and their families were told that that child was inadequately suicidal to be admitted to CAMS. And that is a child who was in an absolute crisis situation themselves. So any review has to not only take into account the children who are on the books of CAMS, but who didn't ever get in there because of the pressure that is on the system, and those who were discharged, even though perhaps their situation was very far from resolved. A lot of it comes back to staffing, and I know the motion identifies a lot of that. The challenge is serious, but we have to do an awful lot better, because our children and our young people across the state, many of them are under unbelievable pressure and find it just so frustrating, and their families find it heartbreaking to try and access services, and then the delays that are involved in that.
Ari, when our young people and our children ask for help, we should be able to turn around and give them the support that they need. And I think that we're very lucky now to be in a society that has become far more open in talking about mental health and mental health struggles. And it's good to see that there's a generation that are growing up now who are willing to speak out and say that they need that they need support. But it is really devastating that we see so many children failed by the very body that is meant to help them. And we have seen different issues with CAMS laid bare and once again in the last number of weeks. And what we do need to do is see urgent action, just ensure that children and adolescents get immediate care when they need it. And in my own area of CHO2, and it covers some of the West, including Galway, it is deeply disturbing to see that in November of last year there were 247 children on waiting lists, with 40 waiting over 39 weeks, 8 of whom have been waiting over a year. And in 2023, we're all well enough aware that early intervention is absolutely crucial. And it's heartbreaking to see that there are children who are left waiting, with parents, to be fair, really not knowing where they're supposed to turn. And it is part of a larger issue that we have in Galway in terms of mental health supports. We see in Galway as well, when it comes to jigsaw services in the county, having a waiting time of 17 weeks, which is the third worst in this state. So that is deeply concerning, that there is a double of that, both within CAMS and then in Jigsaw. Now, of course, it's really important to be very clear to families and to children that they should turn to these supports in their time of need, but we do need to make sure that we're actually dealing with the issues. Tuigim muintir na Gaillimh Cicho Jackar is a táiste an cabhar dasaí an ónar báistí agus ína óga all ó CAMS agus tá sé feici an iscuil gáithí carcha seacht páiste listí feitheamh le carcha acab níos fuide ná tríoch ní seachtain agus ochtar acab níos mú ná bliain. Agus nuair tá an Cicho tábhachtach is atá idirgá lua tá sé weche go seo ag torlú, agus is rud má ag bhfuil dína óga sásta leabhar trína deocrachtaí marathon se tá acab, a cá muid cínte go na servicí an rób, na servicí I jigsá, na servicí a cams, agus go si ná an cabhar dasin wethub a all.
Johnny Maiden.
Mental health services are in a state of flux. The full report on CAMS last week laid before us the threadbare facts from bad governance to neglect. Many factors came to the fore: the deterioration of services, the appalling long waiting lists, and at the end, the failure to look after our young people who are in danger, who need on-the-spot protection, intervention and care. We all have personal stories to tell, like the mother who came to me about her teenage daughter. She was self-harming and had suicide ideation. This was on a Friday night. She was offered a mattress on the floor. Another situation, we had a young girl having attempted suicide on 3 occasions in 1 week and was basically told there was nowhere for her to go and no placement for her, even though the team on the night concluded that she needed to be admitted and medicated. To reach out and ask for help in moments of toil is a measure of desperation, but also bravery. It is the government's responsibility to ensure that the full state of suites with a timely, appropriate diagnosis is given. This is not happening. Our young people are not receiving the duty of care they need and deserve. Recent figures show there is over 100 people on the waiting list for CAMS services in County Wexford. The average waiting time is almost a year, with some waiting longer. That's 100 families in trouble. Imagine the turmoil, upset and suffering being caused to those people and their families. This disintegration of services is happening for several reasons. First and foremost is because of funding. There must be a multi-annual plan to enable CAMS autonomy to delivering quality care at source. We also need to address training issues and increase the number of graduate places for our next generation of mental health workers. Finally, we need to reinstate a national clinic director for mental health to ensure accountability within mental health services. And why was this position removed in 2016? I'm sure every TD in the Dáil have stories to tell from their own constituencies about mental health services. We are appealing to the government to firstly recognise the seriousness and the deterioration of the children and adolescent mental health services, which is happening right now, and the continuing consequential harm the existing system, which is not fit for purpose, as stated in the CAMS report, which is causing young people and their families to lose hope. We hope that all TDs will restore that hope and support this motion.
Thank you very much. Deputy Dessie Ellis.
My constituency of Dublin North West is unfortunately an area with very high suicide rate. According to the statistics provided to the Joint Oireachtas Committee on Children and Youth Affairs in 2019, 1/3 of young people were struggling with mental health issues. This is a very high figure, particularly as the services are severely underfunded. In the last few years, not much has improved, and in fact, the provision of mental health services particularly has got much worse. The pandemic has taken a toll on the mental health of young people. Its impact on young people is yet to be fully understood, but it is clear that there has been a significant rise in both anxiety and depression amongst young people, triggered by the unprecedented stresses caused by the social isolation during the pandemic. Recent studies have shown that there are a significant number of young people who are deliberately harming themselves, and that many young people are experiencing suicidal ideation. Expert evidence shows that the onset of mental disorders peaks during the adolescent and early adult years, and this is one of the leading causes of disability among many young people. This is why early intervention is so important. The recent damning report on CAMS shows that this government has failed significant numbers of children at a time when help was most crucial. If delivered with properly funded services, those children could go on to live productive and fulfilling lives up to and into adulthood. The consequences of the failure to provide care to over 100 children and the failure to follow up in care for another 140 doesn't bear thinking about. These failures have the real possibility of destroying lives and creating obstacles to the future potential of these children, as well as negatively impacting on their employment prospects. These vulnerable children have become even more vulnerable by these failures. It is not an exaggeration to suggest many of these failed children could be condemned to a lifetime of reliance on mental health services. This is shocking and distressing for both the children and for their families. The key is that if young people access mental health supports early, then they are less likely to continue to experience mental health issues into adulthood. These children represent a generation of adolescents and young people who are in urgent need of mental health treatment and who are being failed by this government. government. Dual diagnosis is another area that requires special treatment, and it applies to young adults as much. Sinn Féin has put forward solutions that will ensure that mental health services are properly funded and staffed, and a national clinic and director for mental health is reinstated. Thank you.
We have Deputy McCarthy, 2.5 minutes.
I want to commend Deputy Mark Ward for bringing this very important issue to the core of the Dáil for a private member's debate, and I want to thank both ministers opposite for being here, and to say, and I don't say this to many ministers, I absolutely accept both of your sincerity when it comes to this issue. I believe in your bona fides that you want to address many of the issues and the challenges that have been raised here tonight. But that doesn't mean you can extradite yourself from the absolute failings that have been exposed in recent weeks, some of which came as absolutely no surprise to many families the length and breadth of the country. The fact that the Mental Health Commission was able to establish a new name, a name of lost children, children who were registered with CAM services and who didn't receive the necessary follow-up. I will reiterate the call of the Minister to tell people, both parents and children and teenagers, that need support to seek it. Because my experience and listening to people who have access, when the CAM system works, it works exceptionally well. It saves lives, literally, both in terms of physical lives and also in terms of giving new leases of life to those people who benefit from the service. But the counter is also true. When it doesn't work, when it fails children, it has life-changing consequences for the negative for the rest of their life. So when we hear that the number of children waiting for an appointment in CAMS has increased by 86% since this government took office, with nearly 4,000 waiting for their first appointment. That is deeply concerning. When we hear that 741 people had to actually present themselves in an emergency room last year, that is a fundamental problem. So I welcome the fact that government isn't opposing the motion here tonight. But what Mark Ward has set out in the motion are the solutions and the steps that need to be taken to resolve the issue, to ensure that everybody who experiences the CAM system has a positive experience and that their lives are changed for the better. So my call on ministers and on government is, don't just not oppose the motion, actively support it, and more importantly, implement the measures within it.
Every child deserves an opportunity to reach their full potential, and we know that the state ratified the UN Convention on the Rights of the Child in 1992, and a child's right to the highest attainable standard of health, including mental health, is indivisible from other rights of the child. But the Ombudsman made that very clear in 2018 in his report, where he said, in the case of children and young people experiencing mental health difficulties, fulfilling this right means providing them with the mental health service they need, when they need them and where they need them. Now, on that measurement, on that slot tosh, we are failing our children. And I think when we discuss here, we need to put ourselves into the shoes of that young child, of that young boy, that young girl who's sitting at home and for whatever reason feel that there's nothing to live for anymore, or that their anxiety paralyses them to the point that they can't even step outside their front door. Or put yourself in the shoes of that family who have seen that young child blossom into a young teenager and think that they're struggling because they can't support them, they can't help them, they don't know what to help, and the torture of all of that. But one of the other tortures is the fact that they know that there is help there, but they cannot access that help because CAMS is not available to them. And for far, far too many children, that is the reality. As parents sitting at home, knowing that your child is potentially has suicidal tendencies, but is on a waiting list for months and months and months to see the specialist who may be able to work with that child and to help them in terms of their illness. And in Donegal, for example, we have 300 people who are on waiting list. 100 of them are waiting over 6 months. Our waiting lists have gone up by 86% since this government have come into place. So we can have all the nice words and all the rest. There's nobody in this chamber that doesn't want to protect those children that I'm talking about. None of us. But we have to recognise government is failing here spectacularly. One child being failed is one too many. The fact that we have lost children that are being reported in this report is devastating. But so many individuals are lost because they're not able to get the services that can help them at the time that they need them. And this needs to be fixed urgently. I commend Mark Ward in relation to the motion that he has brought before, the solutions that he has advocated for, and I would strongly urge the government, because I do believe you are failing in relation to this here, because the indicators are all going in the wrong direction. And this isn't about politics, this is about children who need help. And that help is there if these teams that need to be resourced, that need to be empowered, that need to ensure that we extend them to 25-year-olds and many other of the issues that Mark and our colleagues have raised in the past. Thank you.
Look, and I also want to acknowledge both ministers for their time here tonight and for their time last week in relation to this really serious issue in CAMS. And I'm not going to question your bona fides and your interest in mental health, but interest is not enough now. We need action. I'm sitting here and I'm tired and I'm frustrated and I'm listening to all the contributions by everybody across the floor, and it just seems to be a lack of action. Now, my frustration is nothing compared to the frustration that the people are in the gallery are feeling when they're trying to get the care that their children need and their families need, and also the many people who are listening at home and the number of people that would have contacted me over the last couple of months. Minister, and the government have a tactic of not opposing motions, but it's different between not opposing and supporting. It's simply a political game. If you don't oppose it, then you don't have to vote against it when it comes down to it. So we want to see everything that was put, the solutions that I spoke of in the first part of the debate, put into place. But by not opposing this motion, you're admitting that you failed. You failed the 4,000 children who are currently waiting on CAMS lists for initial assessments. When this government came into place, there was only 2,000. That's an 86% increase in the amount of children who are waiting. You failed the 13,000 children who are waiting for primary care psychology appointments. When this government came into place, that was 7,700. That's a 71% increase under this government's watch. That's not acceptable. You failed by the 14% increase in young people who are accessing Pieta for counselling. I met with Pieta during the week, and they told me children as young as 5 are accessing their suicide and self-harm services. You failed the children who are reliant on a postcode lottery for treatment. For example, there's a 4-week waiting list for an appointment for a child or a young person for Jigsaw if they live in Wicklow. But if you were a child or a young person who's living in Cork, you could be waiting up to 30 weeks for that appointment. That is just not good enough. It was mentioned already, the 741 children who are admitted to hospital for mental health difficulties after presenting to A&E. Like in the report it outlines, and I think there's a failure to GPs, because GPs feel they have no choice, it's outlined in the report, but to refer children into emergency departments just to get a psychiatric evaluation, because they know that the waiting list in CAMS, the waiting list in other services is just not there. There's also children who are waiting to be admitted into specialist inpatient care. There are less CAMS beds available now than when this government came into place. Only 51 of the 72 available beds for CAMS are currently occupied. With a further 16 beds, and I was hoping you were going to mention it in your closing remarks, there's a further 16 beds in danger of closing in Cork at the moment. The Psychiatric and Nurses Association came out with a statement during the week. This issue in relation to admitting children into psychiatric wards, it was raised at the UN Conventions of the Rights of a Child in Geneva during the week, and the government responded to that committee that Ireland may never reach a point of no children being admitted to adult units, which shows a huge lack of ambition in this. We need to adhere to international human rights standards. There were 32 admissions of children into adult units in 2021. That's up from 27 in 2020. So, them 32 children spent 217 days in total in adult psychiatric facilities. This is draconian, and it goes against all human rights violations. Minister, by agreeing to this motion, what you're doing is, by not opposing this motion, you're agreeing to the Sinn Féin call to legislate for this. Now, I know the systems aren't in place now. I live in the real world, but we have to be ambitious. We have to put things in place. We have to say, putting children into adult psychiatric facilities, whether they're 16 or 17 or younger than that, is not good enough, and we must put things in place to stop that. And if that's legislation, that's what we're calling for. But Minister, I'm not to mention stats, I mentioned solutions at the start of this, But behind every one of them statistics is a child. There's a child with hopes, dreams and ambitions. There's a child with a family who are lost to what's going on for them, just trying to get the right care for their children, get the right care at the right time in the right place. It's a ripple effect. And as we said already, there is absolutely no greater crime than anybody than denying a child to reach their full potential. Now, I know you didn't oppose this motion, Minister, but I never pleaded for anybody in this stall before. I'm pleading that you put the solutions that Sinn Féin brought forward into place.
Thank you, Deputy. That concludes the private member's business. I'll now put the question on the motion as follows. That the question is that the motion be agreed. Deputies who are in favour say "tá." Deputies who are against say "nil." So in my opinion the question is carried. That concludes the private member's business.